Regional Office of PCO in Chicago. He also serves as the Assistant Director of the National Center for Mobility and Accidents, which is funded by the FDA. He has over 30 years of experience at federal and national levels. Human services and technical assistance. We also will be hearing from Janelle Thomas, now is Director of National Initiatives at the nonprofit organization Partners for Youth with Disabilities, or PYD. PYD provides one-to-one, group, and online mentoring to youth with disabilities to help them build healthy relationship skills and responsibility. PYD also provides training to youth organizations of how to be more considerate of youth with disabilities. I'm passionate about empowering organizations to become inclusive and representative of all abilities to reach their full potential. And then finally, Janelle will have a conversation with Austin Carr about his personal experience as a transportation advocate. Austin lives in the Boston area and has been actively engaged as a self-advocate with many disability organizations for the last several years, particularly with the Eastern Field Youth Leadership Network Group and with PYD, where he's an intern, is on the party planning committee, and is a youth participant. Austin also hosts a weekly radio conference at Perkins School for the Blind, and Austin has cerebral palsy.
We see your messages about the audio, and we are working on it. We've asked our speaker to move closer to the microphone. Okay. Danielle, if you'd like, we can go ahead and get started.
Great. Thanks all so much. I appreciate you including the U.S. Department of Transportation on today's webinar. As the speaker just said, my name is Janelle Thomas, and I work at the Federal Transit Administration, which is one of the operating divisions at the U.S. Department of Transportation. And if you go to the next slide, I just wanted to share with you an initiative called the Coordinated Council on Access and Mobility, or CCAM for short. The CCAM was started back in 2004 by an executive order by George W. Bush. The mission of this council is to issue policy recommendations and implement activities that improve the availability, accessibility, and efficiency of transportation for three targeted populations, those being individuals with disabilities of all ages, older adults, and individuals of low income, again of all ages. And you'd be surprised, but there's actually 11 federal agencies involved in this coordinating council, and across those organizations you see on the slide, we fund a total of 130 different federal programs that can fund transportation. I think what people are most surprised by is that the majority of the programs aren't actually at USDOT, who is the chair of this organization. They're actually under HHS, or the Department of Health and Human Services, which funds 66 of those 130 programs. And people are usually surprised to see the Department of the Interior as a member organization, but they actually fund three specific tribal transportation programs under the Interior. So on the next slide, I just wanted to share a little bit about who we are at the Federal Transit Administration. And so we fund over 10 billion trips annually to our public transportation customers. And we have over 4,000 different public transit providers across the country. And I included that screen capture of a map there to show you where you'll and then if you go to the next slide, I just wanted to share with you one of our programs. We have several different programs here at the Federal Transit Administration, but the one most important, I think, to the audience on today is our Section 5310 program. We call everything by the section of the law, but what that program is the Enhanced Mobility of Seniors and Individuals with Disabilities program. And what that is a program that goes to each state DOT based on census data, specifically based on the number of older adults and people with disabilities in each state. And then the state DOT puts the money out to local communities to improve mobility access for those targeted populations. And the one thing I wanted to share today about this program is this program statutorily requires what's called a locally developed coordinated human services transportation plan. And what this is a plan that identifies the transportation needs and older adults in communities, and then has strategies for meeting those needs. And the purpose of it is to prioritize the funding, because there's never enough funding. But what should each state prioritize? And if you haven't seen it, there is a map there. You can click on your state, find your local community, and see your current plan. And if you go to the next page, I wanted to give you one example of a program, a local program, and this one is out of Michigan. And this is how an example of how Michigan is spending some of their Section 5310 funds. So it's a local program that focuses on children and youth with disabilities, teaching them to become self-advocates for biking and alternative modes of transportation, which has shown to improve their self-esteem, foster healthy lifestyles, and there's a link to the program there. And the program has since grown to become also an active transportation program where teaching these youth with disabilities to also become advocates in their community and then youth peers. And if you go to the next slide, I just wanted to share that the Coordinated Council on Access and Mobility has a pilot program that goes out annually, and they just announced in October 2019 this year's program. So unfortunately, it's already closed. No one can apply right now because they're still reviewing the application, but it will be open again next year. And the pilot program is about increasing access for all. And so we're very excited. We'll be announcing the winning applications later this winter or in early spring. And then we are going to have another notice of opportunity that will be out next year, so stay tuned. And then the next slide shows a free 2-day course called Advancing Mobility Management. The goal of this program is to get transportation stakeholders and the disability community in a room together within a region, holding the course in all 10 regions over the next 2 years. And the goal is to get non-traditional stakeholders together at the table to find programs that work in their community to increase access. And so the course includes hands-on materials, showing rural, urban, and suburban programs in mobility management and travel training that have worked, and how to replicate those in your own community. So I recommend if you're interested, click on the link there and you can register. And then my last slide is the next one. I just wanted to leave you with some free resources. So here are 3 of our technical assistance centers that we fund. The top one there, the National Center for Mobility Management, you're about to hear from Judy Shanley in just a moment. But the other 2 I just wanted to share, the National Aging and Disability Transportation Center. This is a partnership we have with the HHS Administration for Community Living. And so this is a great program with resources and annual community grants. Both the 2 centers there provide annual planning grants for $25,000 and then implementation grants from anywhere from $75,000 to $150,000 to help communities come up with innovative solutions and really prepare them to apply for SPA's larger grants. And then the last center there, the National Rural Transit Assistance Program. If you're in a rural community, this is a great resource. And with that, I want to pass it along to my colleague, Judy Shanley, and I look forward to answering any questions you might have at the end. Thank you.
Hi, everybody. This is Judy. Thanks, Danielle, and thank you to NIMH for co-hosting this webinar with us. We're so excited, and I'm particularly excited about the opportunity to talk about transportation and mobility as it relates to transition and youth with autism. I worked as a number of years as a vocational rehab counselor at the ARC and UCT, and I also worked as a transition coordinator, and always was frustrated that I worked really, really hard in the strategies and assessment and career counseling, and yet students couldn't get jobs. They couldn't go to college because they didn't have transportation. So I am very excited to be working on this topic. The next slide just gives you kind of a preview of what I'm going to be talking about. First, we'll talk about the next slide, the challenges and opportunities, and you know very well some of those challenges and opportunities. We'll talk about some strategies that I've learned working at the national level and local level, and then we'll hear from Janelle and Austin to give you an example of a program that has been implemented successfully to address transportation advocacy. I'm going to be talking about mobility management resources because mobility management represents an opportunity for those of us who are in human services and direct services to really engage with transportation providers and transit systems in community. And finally, I too will be looking forward to any comments or questions that you have at the end. The next slide just, again, previews who we are. I'm the Eastern Field Director of the NCMM, and I also oversee my work at Eastern Field national level, the education and youth transition, and we'll be hearing from Janelle and Austin. The next slide. This is a motto of mine. If you always do what you've always done, you'll always get what you've always got. And this was in a book by Fierce Conversations, entitled Fierce Conversations by Susan Scott. And it's really looking at the whole challenge of transportation in new and innovative ways. And the next slide, it has always amazed me that we've got all this legislation and policy across school settings and higher ed settings and workforce, things like LRE and inclusion and home and community-based services, and we've got legislation like the ADA and the Higher Ed Opportunity Act, all reinforcing the notion of inclusive transportation. So doesn't it make sense to think about inclusive transportation options for individuals with disabilities, especially those with autism? Since we have these policies in the settings that promote inclusion, we also have to think about how these policies extend to inclusive transportation. On the next slide, I want you to think about why does mobility and transportation pose a barrier to student transition? It's really important to think about the root causes of why transportation is a challenge. And the next slide are some of the underlying reasons students may lack the knowledge and skills. Students may be fearful, and this is particularly important for students with autism who may have sensory issues and are fearful of crowds and noise and the stimulation that may be found in large transportation modes. Families may be fearful. You know, it could be that students use the personal vehicle with their families to get around much of their life, and now they're transitioning to post-school settings, and so families don't have any experience themselves with using any other mode but a family car. Also, teachers are fearful. You know, we as educators and student service professionals want to protect the individuals we work with, and we may not have any experience using any kind of transportation mode other than driving a car, and so we may have fears or anxieties associated with encouraging the students that we work with to use transportation. It also may be connections, there may be lack of connections with public transit. When I go out and I do workshops with school districts and vocational rehab agencies and transition coordinators, I ask how many of you have connections with any of the mobility management or public transportation systems in their communities, and more often than not, they're saying that they don't. And then conversely, when I go to public transit forums and I speak with transportation providers and transportation planners, I ask, how many of you have had experiences or have relationships with school districts or vocational rehab or adult service agencies? And few of them do. So, I think that really understanding these root causes and including the fact that there may not be transportation options in rural communities. But I hope what you learn today is there more options than not, and maybe those that you haven't even think about. And especially in rural areas, transportation can be inconvenient. It may be a long distance between where a student lives and where a transportation mode may start. So thinking about the convenience and then cost is certainly a factor in understanding root causes. But the most important thing on that next slide, this is what really underlies the work that we do and the focus on transportation. This is from a youth. We were working with Chicago Public Schools, and one of the youth said, I feel like I'm independent. I don't need to depend upon my mom and dad to take me places. Now I can ride the bus to get to my job and to the movies with my friends. And it's all about spontaneous choice. It's all about youth getting to places that they want to go when they need to go, when they need to get there, and it's spontaneous choice. So here's some of the strategies that we've learned about that really can help transition professionals, vocational rehab professionals, engage in transportation education. One of the things I mentioned before is families and students may be fearful about using transportation or exploring alternate transportation modes. And so we worked with several school districts around the country in rural areas and in suburban and urban areas. They held a transportation summit. And it was really neat because at the summit, it was students who learned to independently travel. We paired them with students who were in the transition phases where they were learning how to use transportation, and we established a peer mentoring program for those students. And we also had businesses on a panel there, and the businesses emphasized to families how important it was to have reliable employees and how important it was to the independence of their employees to have reliable transportation. We also have done resource mapping. I was working with some rural areas in Ohio with Ohio school districts, and students were engaged in projects where they did a map of all of the transportation services that might be available. So they looked at state-based organizations and whether any of those organizations had vehicles that just sat there. I was working with our affiliate in Iowa, and I went to a summer camp program that they had, and there were 30 wheelchair accessible vehicles just sitting in the parking lot. And I kept thinking, oh my gosh, what a great opportunity to use these vehicles to transport people to jobs, to transport people to health care, to use the vehicles to support youth in obtaining jobs. So when the students in the school district did this resource mapping, they identified transportation resources that they never had thought about before. Also, including mobility and transportation in the IEP goal. And also in pre-ed goals, as you're thinking about the pre-ed services that WIOA requires, is mobility and transportation part of those goals and the outcomes that you hope to focus on. Inviting transit professionals into events. Transportation professionals love working with school districts. The students that are leaving school represent the future revenue for transportation service providers. So the earlier that students can get familiar and accustomed to various transportation services, the more apt that they're probably going to use that service when they leave high school. I mentioned in transportation-related projects and service learning in another school district we work with. Karen did a presentation to the local school board about the need for transportation. So students were empowered, and these were students with autism and IDD. So they in their own voice, they were talking about how important it was for them to have available transportation services and how their voice mattered. Looking for grant opportunities, Danielle mentioned the CCAM work and 130 programs that support transportation. I suggest that you go and the link was provided to the FTA website where those 130 programs are. If you have any of these programs in your local communities or your state, knock on the doors of the people that administer those grants and find out whether any of those funds can be used for transportation for your students. Also, integrating transportation content into professional development for educators. I had school districts that went to the local transit agency and got brochures about the various transportation services that that provider offered and left the brochures in the teacher's lounge of her school building as a way to emphasize and educate her colleagues about transportation. Simulate bus using classroom or non-bus settings. For students with autism, the sensory issues associated with riding a bus or being on a vehicle with lots of people and lots of commotion may be overwhelming. And so one school district we were working with simulated a bus in a classroom. So they made their classroom look like a bus, and they had seating in different places. Students would get used to sitting in different places on the bus. And then finally establishing peer-to-peer mentoring program or class study program. That's a truly effective way of educating youth. Next slide. So in rural areas, where routes may be geographically dispersed, there may not be fixed route systems, we see a variety of programs like volunteer driver programs. How many of you know that you even have volunteer driver programs in your community? The Corporation for National Community Service uses a lot of their funds through Senior Corps and AmeriCorps to implement volunteer driver programs. And that's a real viable service for our students. And also in rural areas, there's much more demand response systems. And those are systems that when the individual needs a ride, like a child ride program, they call and get the service. So those are much more prevalent in rural areas because the demand for fixed route or dedicated bus lines or trains or kind of high volume service may not be warranted in those places. Also, in rural communities, we see much more engagement by employers and healthcare, non-traditional service providers to be part of the transportation solution. So, for instance, we're working with communities in rural parts of Ohio and employers because employers need dedicated employees and they have to get these employees to work. So they're actually part of providing a transportation service to the community. They're actually paying for it. They're part of conceptualizing and planning. Healthcare providers too. Healthcare providers need people to get to their medical appointments. There's a huge data associated with the cost of missed appointments. And so thinking about all non-traditional kinds of service providers is really important. I've also heard of Uber, like an Uber-like service, almost like an organic rideshare program that pops up in rural areas. So it may be a ride board at a local state-based organization of people that are traveling to a employment site or a particular geographic area of a community, and they sign up for people that give them rides. So I think in rural areas, by nature, they've had to be entrepreneurial in thinking about the transportation services that are available. And the next slide, I want you to begin thinking about how do you build connections to transportation? How do you develop connections with transportation providers and services that maybe you had not even thought about? On the next slide, the two audiences that you could build connections with are the actual transit systems, the transit providers, and mobility management. And on the next slide, mobility management connects the field that I work in is simply a connected network in a community. So it's thinking about what the customer needs are, including students, including adults, including older adults, those with low income, and building a coordinated transportation network that is reflective of the needs. So many communities around the country have mobility management networks, and they have people that are doing this coordination called mobility managers. And on the next slide, this is how you can find out about whether your community, what transportation services may be available. Certainly, our project, the National Center for Mobility Management, we provide direct technical assistance. It's free, so I encourage you to access our materials. Also, contacting your State Department of Transportation, the Public Transit Office, particularly regarding those 5310 grants that Danielle mentioned. If you want to avail yourself of those grants, finding out when the timeline is, when the state is going to issue the RFP for those grants will be a good idea. Contact your local mobility manager and be part of those discussions. If there's local coordination meetings and council meetings, be engaged. I was working with the school district in Texas, and the student and the transition coordinator attended a community coordination meeting, and the transit agency had no idea that students needed to get to after-school jobs. No idea. And so what they did by having that transition coordinator and student at the table, the transit agency was able to change their route, and it didn't interfere with any of the school transportation, public transportation, because the bus was still available to the public, but it deviated, it went like a block in a different direction than it previously had, and it picked up students from the school that needed to get into a city center to go to jobs. And if the student and the transition coordinator had not been at that meeting, at that community coordination meeting, the transit provider would never have known that their need existed. So on the next slide, here's my the URL to our center, and we help communities build these systems, build these coordinated networks, build mobility management. And on the next slide, it just gives you an overview of who we are. We've been around since 2013, and there's 3 organizations that are part of our center: Easterfield, and the American Public Transportation Association, and the Community Transportation Association of America. And we're funded by Danielle's office, the Federal Transit Administration. So on the next slide, again, I'm all about mottos, and this is something that resonates with me. Always believe that something wonderful is about to happen. And that's how I feel this whole field about transportation and transition is. We're just learning about the various strategies that we can use, but it's amazing and it's dynamic, and I'm glad that you're all interested in this topic. So on the next slide is my contact information, and I look forward to having discussion with you at the end of this webinar, and also after the webinar. Feel free to reach out to me. Thank you, and I'll turn it over to Janelle Thomas.
Thank you, Janelle. And can I just break in just for one moment? I just want to note for all our participants, we will send a PDF of all the slides to you using the email address that you provided when you logged into the WebEx. So we will be providing that very soon. Okay, Janelle, thank you.
Thank you, and thank you, Judy. Before I dive into my part of the presentation, I want to be sure everybody can hear me clearly. Can you just enter into your chat if you're hearing me well? Okay, good. It looks like everybody's hearing me well. Well, I'm really excited to be here to talk to you about a project that I affectionately call the TAMI project, or the Transportation Advocacy Mentoring Initiative. And as Judy said, my name is Janelle Thomas, and I work with Partners for Youth with Disabilities. And you'll hear me refer to Partners for Youth with Disabilities as PYD. And at PYD, we've been around for almost 35 years, with a real focus on ensuring that youth and young adults with disabilities live with dignity, purpose, and pride. And in an effort to meet that goal, we focus on a number of different direct service programming options within primarily the New England area. But my role is to oversee our national support for organizations who are seeking to become more inclusive, and also to take programs that we have seen work within PYD's network and help other organizations to replicate them around the country. And as I mentioned earlier, because we're focused on dignity, purpose, and pride, it's very difficult for youth or young adults to have dignity, purpose, and pride if you don't talk about transportation as part of the equation. It is absolutely the top barrier we see to youth participating in after-school programs and recreation, in employment opportunities, including internships, and then ultimately employment. So for people with disabilities, we just see over and over how transportation is just the most significant challenge. And so next slide, please. And so as I mentioned, I'm here to talk to you about TAMI, or the Transportation Advocacy Mentoring Initiative, which we piloted about 2.5 years ago in an effort to find one way to overcome this kind of obstacles and this kind of obstacle. And because PYD is really focused on mentoring as an intervention, we decided to focus on mentoring as a way to decrease transportation barriers. And so this was as I said, this was a demonstration project where we paired young adults with disabilities from Massachusetts with young advocates with disabilities from Michigan. And these young advocates in Michigan were also young adults, mostly young adults who had intellectual disabilities and who had already experienced success advocating for inclusive transportation options. And these young adults who were the peer mentors in the program, they were from an organization called PEAK, P-E-A-K, and P-E-A-C. And PEAK has been very successful in teaching young adults with disabilities to advocate for inclusive transportation options. And so we thought that our young adults in Massachusetts could learn from that. We did this through a series of interactive mentoring and educational sessions. And of course, because of the geography, we did everything online through live video, similar to what we're doing here. And the young adults from Massachusetts learned from the Michigan young adults to prepare to engage in their own advocacy project. We were really pleased to be funded by the Department of Health and Human Services, the Administration for Community Living, through an agreement with the Community Transportation Association of America, or CTAA, and our collaborators were Easterfield, Judy, who's on the panel, Partners for Youth with Disabilities, and Peak. Next slide, please. So I know I'm probably preaching to the choir when I share this slide, but why is this project important? Well, there were lots of reasons. One, I already shared, what we've seen with transportation being just a key, if not the most key barrier to youth success, a young adult success transitioning into adulthood. So we wanted to help young adults think about inclusive mobility options. We wanted to assist transit providers to consider the voices of youth with disabilities in service planning. We wanted to impact change, improve the range of accessible transportation options, and we also thought it was important to highlight the viabilities of careers in transportation to the young adults who were being peer mentored from the young adults in Michigan. Next slide, please. And so there was a step-by-step project implementation that we did, and I really believe that this focus on project implementation helped us be successful, and I'll talk about that a little bit more later, the keys to our success. But one thing I want to also share is, as a result of this project, we did publish a guidebook for any community or any organization that's seeking to replicate this type of model, and that will be sent out to you after this session. And it talks specifically about what to do, how to do it. There's some videos to give examples of what we did, so I hope that that's helpful to folks. So the steps were finding the collaborators, the recruitment of the advocates, a peer mentor training. We thought it was incredibly important to empower our peer mentors in Michigan to understand what the role of being a mentor was. We spent some time building trust through introductions and getting to know you. We had the learning sessions. We then took our learning and put it into a tangible advocacy project that was completely driven by the advocate. We had some closure exercises, and then we evaluated the success of the project. All right, next slide, please. So as I mentioned, since it was the first time we had done the project and it was a pilot, we learned a lot, and we also identified some keys to success, things that we think, had we not done, we wouldn't have experienced the same results. So next slide. So we felt like our keys to success were that, number one, we recruited a very diverse group of young adults to be our advocates in Massachusetts. And part of what made this group gel together is the diversity of the group, both in terms of geography, background, and disability. We had many different types of disabilities represented in this group, and we also had it be an application process. And I think that was important because all of them came to the table with some sort of prior leadership training. You know, it might have been basic, it might have been more advanced, but we were able to identify advocates who had these kinds of skills. We also had the supportive training for the peer advocates or peer mentors in Michigan that I spoke of. I think most people are hesitant to mentor because they don't feel like they have what it takes. They don't know what mentoring is. And so that training and empowering ahead of time was critical to that group feeling like they had the skills and the knowledge to be helpful to the advocates in Massachusetts. It was a process driven completely by the advocates. Our team put up some structure in terms of the implementation of the project, but everything else was advocate driven, which I think really improved the learning gains at the end. And then we also had clear and realistic metrics for evaluation. We didn't expect that, we would change the world in a 6-month series of sessions, but we did know that we could make some changes. And so we measured those in terms of learning gains, some short-term learning gains, and we're really pleased with those results. One other thing before I introduce my friend Austin Carr is to say one other success that we did have, which was very unexpected, is that when the team of advocates in Massachusetts conducted their advocacy project, it did lead to results in Massachusetts in terms of how the public transportation system operates in one way, and I can have Austin share more about that. So I am going to introduce Austin Carr to you. He is a person who participated in the project and has become a friend and a colleague of mine. As you heard from the introductions at the beginning, Austin is a man about town. He assists so many organizations to be better and lends his talents in so many ways. So I'm really pleased to have him share his advocate perspective. So what he and I are going to do now is just have a conversation and let you all be flies on the wall. I'm going to interview him, and he's going to share from his voice what he experienced as being a part of the project. So hi, Austin. How are you doing?
Good to know how are you, and thank you for having me on today. Can you hear me okay?
Oh, great. I can hear you loud and clear. So
okay.
This is going to be fun for us to talk about the TAMI project.
Yeah.
So I'm going to ask you the first question. Why did you apply to be a transportation advocate?
Well, I applied to be a transportation advocate because I felt like it was important to hear transportation stories from other youth with disabilities and hear their barriers to transportation and how to resolve those issues for the whole disability community.
Great, thank you. And what did you learn from the peer mentors in Michigan?
I learned that advocacy takes time. Sometimes it takes more time than we think, and that when we have more than one voice, we realize that our goals are faster.
Well, thank you. I think both of those are really true. Advocacy can take time, especially if you're trying to make systems change. And I do agree, our collective voices are usually stronger than our individual voices. Great. Can you describe what your team did, what they chose for their advocacy project, and how they carried it out?
Yes, we chose to work on our trolley cars, which is tax cars, which is for those folks who are unfamiliar with that terminology. They are low-rated, discounted fares for people with disabilities, and we wanted the tax locations to be more more accessible. And there was only one current location at the time, and at that time, the place to get your tap card was in downtown Jackson, in Boston.
So, Austin, thank you for helping to explain the terminology to folks. Yeah, the TAP card is a low-fare discounted card for people with disabilities, and the team found that there was only one place where you could apply for your TAP card, and it was downtown and required you to know what you're doing on the public transportation to get there to even apply for this. And so am I understanding correctly that your team wanted more accessible ways to apply and receive your TAP card?
Yes. That's
great.
That's correct.
Okay, super. So tell me, what did you do to get your point across to the MBTA?
Well, after a little consideration, we decided as a group to write a letter to the MBTA, like a personal testimony almost about why we were taking this project up to make more accessible. So we wrote a letter to the head of the MBTA, and we heard back within a few months.
Yeah, that's great. I think you made a really good point about you added personal testimony to the facts and figures in the letter. And if I'm remembering correctly, one of your teammates hand-delivered the letter, and then you all followed up with an email as well. So there was no way they were going to ignore your written communication. You covered all your bases. So this is not on the list of questions, but you and I talked about this earlier. We have found that your advocacy made a difference. So can you tell folks how the MBTA changed, and now you can order your TAP card and also receive it in a different way? And how is that?
You can now receive and order your TAP card online and receive it in the mail.
Yes, so that was a very unexpected result. We knew we were going to advocate, and we knew we were going to have our voices heard, but we did not know we would impact change. So congratulations to your group for that.
Thank you, Janelle.
So what did you, oh, you're welcome, Austin. So what did you learn from participating?
I learned from participating that you really need to be persistent in what you're asking for, and share personal stories, and everybody on the team at the time had a little different perspective, so each participant's perspective added a unique value to the story, and I think the value and the authenticity really came across in the letter.
Oh, yeah, that's a really good point. I agree with that. The personal stories did add a lot of authenticity. So now, how are you using the skills that you learned?
I'm taking the team more confidently, and I'm able to navigate my transportation system with my friends and brother more effectively.
Oh, that's great. A wonderful win for everybody when they learn how to use the transportation system more effectively. I think the other, real positive to this, Austin, is just that because you're so active in the Boston community and you're such an advocate around disability and disability rights, you're going to take that knowledge of transportation and your knowledge of advocacy to every organization that you assist now, and even to the individuals that you work with and talk to. And I think there's going to be a ripple effect that we can't even know now, just because you're going to be able to share your skills and your knowledge from your participation. So I'm really glad that I had the chance to work with you on that project, and thank you for being here.
You're welcome, Janelle. Thank you for what you do too. And to us, if anybody has any follow-up questions, I'll be here throughout the remainder too. So feel free to ask me any questions too.
That's great. Thanks, Austin. So that's the remainder of the presentation for Austin and I. And so I'm going to turn it back over. Oh, here's a picture. This is before I turn it over. Here's a picture of Austin and Austin's brother and one of the former staff people and current mentors at CYG, Eli Wolf. And you can see the picture of them getting ready to ride the public bus. So thanks, everyone.
Okay, thank you so much, all of you, Danielle, to Austin. I don't know if you guys and you're getting lots of thank yous from the people who were listening for sharing your expertise. We have had a few questions, and I'm going to start by reading some of them off in the few minutes that we have left. Also, just to repeat what Frank said earlier, we will send a PDF of the slides, which will have all of those resources in it, and the guidebook that Janelle spoke about to the email that you can sign into the webinar. One question that came through that may be on a lot of people's mind has to do with sensory sensitive transportation services. So I think this question could be for any of you. Are any of you familiar with any communities that are working on developing sensory sensitive transportation services? And if not, do you have some thoughts for how someone might get started on working on such an issue?
This is Judy. I think that transit agencies want to increase ridership. And one way they can do that is by having a comfortable and safe and good experience for all passengers, and that includes any sensory experiences that they have. The sound and the way buses are made, the way transportation is made, the vehicles themselves are a lot more protective in terms of sound. I don't know of specific public vehicles that are necessarily sensory sensitive. Danielle, do you have any information about that? No, I think if you're trying to identify the best option for youth, thinking about the sensory needs of that individual is really important. And so maybe encouraging that youth to ride a bus or a smaller vehicle on off-peak times where it's not so chaotic, not so frenetic is a good choice. Having them, weight in places that are sound protected might be important for an individual, but I don't know of particular vehicles that are being made for individuals with autism. I think sound muffling headphones and those kinds of things have been used for students with autism that I've worked with, and all other ways to mitigate the sensory stimuli that might be available with a large crowd.
We have funding available for technology advances at the Federal Transit Administration's travel training, apps, wayfinding. So if someone's interested in innovating in this space, our funding is eligible to be used for it. I'm just not familiar with anybody that's innovating with our funding to do this yet. So I think there is a need from hearing from all on this webinar, and hopefully others are interested in sort of getting into that space.
Thank you both. So I think you may have gone through this, Danielle, before, but just to recap, how can people find out what services or opportunities are available in their community? Was that that you showed with the state?
A great question. The first way I would suggest starting is on slide 4, where I talked about the Section 5310 required coordinated plan. Go ahead and click on that. The National Center for Mobility Management, we fund Judy and she has 2 other colleagues that do the National Center. They manage a website there with coordinated human services plans. So I would suggest the way to start, click on your state and see what they are currently funding. One, you don't want to duplicate what's already being funded, but if you see that there is not a lot of programs, for example, youth with disabilities, there's a need there. So please engage in that coordinated planning process. It's required they do it every 4 years. So based on the year of the coordinated plan listed, you'll know when they're updating it. And if you want to directly contact the state DOT, all you have to Google is Section 5310, your state, so if it's Michigan, and then DOT, State DOT, and it'll give you the Section 5310 program manager. And just reach out to that individual and say you're interested in either applying for the funding or learning more about it. But it's a state-run and state-managed program.
Okay, thank you, Brenda.
And this is Judy. Someone asked about how they can find out about the grant program. I pasted the URL to the FTA site that has the inventory of 130 programs. And I would use that inventory, find out if any of those grants exist in your state, and find out if you can partner with them or how you could work with them either in the current round of funding or in the future round of funding to address the needs of youth in your program.
And I'll just also mention, I'm just putting in the chat function for everybody. The National Center for Mobility Management puts out annual planning grants as well as implementation grants, as does our other center, the National Center for Aging and Disabilities, so also put that link up. So you also can apply directly to our technical assistance centers, which is a slightly easier process than coming in directly to FTA. So I would say if you're going to start, the TA center grants are a good first start before you go into the big FTA grants. Are a little bit more, as I'm told, tough.
Okay, thank you. So this is great information. Thank you so much to all of the speakers. Someone asked if there's a certificate for participating in the webinar. We don't have one, but if you send an email with your email address, when you get the slides, if you respond and send an email that you need a letter saying you attended the webinar, we can provide that for you. So thank you again to Judy, Janelle, Danielle, and Austin. This was incredibly informative, and thank you so much.
Thank you for hosting the webinar and for everyone who participated.
Thank you. Bye-bye. Bye-bye.
Bye.
We didn't